The school system will provide physical or mechanical type systems that eliminate hazards at their source. Appropriate puncture-resistant leak-proof containers should be provided on playing fields and in gymnasiums for disposing towels soaked with blood or other potentially infected body fluids. The custodian should be responsible for cleaning up body fluid spills using proper decontamination procedures. Whenever you're faced with cleaning up blood or body fluids, always wear the necessary personal protective equipment. Make sure that all equipment and environmental and working surfaces are cleaned and decontaminated after contact with blood or other potentially infectious materials. In addition, remember, never pick up broken glass or other sharp objects with your hands. Always use a broom and dustpan. Make sure you know what engineering controls are available at your school and use them. Work practices are specific procedures you must follow on the job to reduce your exposure to blood and other potentially infectious materials. Good work practices help to isolate you from potentially infectious material. Your school's exposure control plan will specifically identify safe procedures for dealing with student injuries. One of the most effective work practice controls is also one of the most basic. Wash your hands. In addition to bloodborne pathogens, there are many other types of viral and infectious diseases that can be spread by hand contact. If infectious material does get on your hands, the sooner you wash it off, the less chance you have of becoming infected. Wash carefully and thoroughly. Make sure to use plenty of non-abrasive soap, rinse completely, and dry with a clean towel. If mucous membranes are exposed, flush with water as soon as possible. Proper washing will prevent you from transferring contamination to other areas of your body or the environment. Your school system will provide hand washing facilities in or near your work area. Here are some controls based on personal hygiene that you must also follow. If a student or co-worker injury involves blood or other potentially infectious material, you must minimize splashing, spraying, spattering, and generation of droplets. Do not eat, drink, smoke, apply cosmetics or lip balms, or handle contact lenses where there's a reasonable likelihood of occupational exposure to body fluids. Personal protective equipment, or PPE, is your third barrier. Equipment that protects you from contact with blood or other potentially infectious material may include gloves, gowns, aprons, lab coats, face shields, protective eyewear, masks, mouthpieces, resuscitation bags, and other ventilation devices. The type of protective equipment appropriate for your job varies with the task and the degree of exposure you anticipate. In other words, dress for the occasion. Appropriate means, under normal work conditions, protective equipment will prevent blood or other potentially infectious materials from contacting your work clothes, street clothes, undergarments, skin, or mucous membranes. For instance, cotton gloves that absorb liquids are not an appropriate barrier protection against bloodborne pathogens. The school system will provide appropriate personal protective equipment in a location accessible to your work area, such as the custodian's closet or on each hall. In addition, your school system will maintain, replace, and dispose of protective equipment at no cost to you. You and your school system must work together to ensure that your protective equipment does its job. First, you must be trained to use the equipment properly. Second, it must be appropriate for the task. Third, the equipment must fit properly. This is especially important with gloves. And if you're allergic to latex or vinyl gloves, your school system will provide hypoallergenic gloves, glove liners, powderless gloves, or another alternative. Fourth, all equipment must be free of physical flaws that could compromise safety. Finally, you must use appropriate protective equipment each time you perform a task involving potentially infectious material. When any one of these conditions is not fully met, you are at risk. If, when wearing equipment, it becomes penetrated by blood or other infectious material, remove it as soon as possible. Before leaving the work area, remove all protective equipment and place in the designated area or container for washing, decontamination, or disposal. Two types of personal protective equipment deserve special mention. The first is mechanical emergency respiratory devices and pocket masks designed to isolate you from contact with a victim's saliva and body fluids. Avoid using unprotected mouth-to-mouth resuscitation. The student or co-worker may have blood or other infectious materials in the mouth or may expel them during resuscitation. Remember, 1 cubic centimeter of hepatitis B virus-contaminated blood can contain 100 million infectious particles of HBV. The second type of equipment is gloves, the most widely used and basic form of personal protective equipment. You must wear gloves when it is reasonably anticipated that you may have hand contact with blood, other potentially infectious material, mucous membrane, or non-intact skin. Gloves may be made of latex or vinyl when used for first aid. Heavy-duty utility gloves are used for housekeeping. Since gloves can be torn or punctured, cover any hand cuts or skin abrasions with bandages before you arrive at school. Replace disposable single-use gloves as soon as possible if they're contaminated, torn, punctured, or no longer offer effective barrier protection. Never wash or decontaminate disposable single-use gloves for reuse. Utility gloves may be decontaminated or reused if they're not cracked, peeling, torn, punctured, and if they otherwise offer barrier protection. Finally, be careful when removing gloves. While both hands are gloved, peel one glove off from top to bottom, holding it in the gloved hand. With the exposed hand, peel the second glove from the top, tucking the first glove inside the second. Dispose of the entire bundle promptly. Never touch the outside of the glove with your bare skin. Gloves should be removed when they become contaminated, damaged, or immediately after finishing the task. Every time you remove your gloves, wash your hands with soap and running water as soon as possible. As we've seen, no barrier is 100% effective, so hand washing after glove removal is critical. One of the best ways to protect yourself from hepatitis B infection is to roll up your sleeve. If you are exposed to blood or other potentially infectious materials, your school system will make the hepatitis B vaccination available to you at no cost. Administration of the vaccine should begin within 24 hours of exposure. The vaccines used today are not only safe, they're 85 to 97% effective at protecting you from contracting HBV or becoming a carrier for 9 years or longer if the series is completed. The fifth and final protective barrier is housekeeping. Good housekeeping should be everyone's responsibility. The entire school needs to be aware of the dangers of bloodborne pathogens. Your facility's exposure control plan will list specific methods and regular schedules for cleaning environmental surfaces possibly contaminated with potentially infectious materials. It is suggested that the janitorial staff keep close surveillance of the restrooms in order to control contamination after accidents. Here are some general rules. All equipment and environmental working surfaces must be cleaned and decontaminated with an appropriate disinfectant or a 10% bleach and water solution as soon as possible after contact with blood or other potentially infectious material. Use a broom and dustpan to pick up broken glass, not your hands. Contaminated sharps and other potentially infectious wastes must be placed in labeled or color-coded leak-proof containers that are closable and easily accessible to those who use them. Containers should not be allowed to overfill. Handle contaminated laundry as little as possible and with minimal agitation. Place in labeled or color-coded bags or containers at locations where it is used without sorting or rinsing. Use leak-proof bags to transport wet laundry. Wear gloves and other appropriate personal protective equipment if you work with contaminated laundry. Bins, pails, cans, and similar receptacles that are reused and have a reasonable likelihood for becoming contaminated with blood or other infectious materials shall be inspected and decontaminated on a regularly scheduled basis. The Bloodborne Pathogen Standard has additional provisions to protect you. Even when you play it safe, accidents may happen. If you're exposed, report the incident to your supervisor as soon as possible. If you consent, your employer will provide you with a confidential medical evaluation, blood tests, post-exposure preventive treatment if available, and follow-up counseling. Be on the lookout for fluorescent orange-red labels, red bags, and containers with a biohazard symbol. They warn you when the contents of containers used for waste, storage, or shipping contain blood or other potentially infectious material. Warning labels are also used to designate contaminated equipment. And finally, your school system provides you with a free training program during working hours before you assume a job with occupational exposure and annually thereafter. Protecting yourself from bloodborne diseases on the job requires knowing the facts and taking sensible precautions. By working together with your school system, you can teach and care for students safely and more effectively. So don't take unnecessary risks. As a professional educator backed by the OSHA Bloodborne Pathogen Standard and your school's exposure control plan, you can confidently protect yourself from bloodborne infection and safely give our children their most valuable asset, an education.